Grateful for Walter coming in here tonight to talk about a very hot topic, which is very much burning in the news, along a lot of other stuff. But the attacks of Bobby Kennedy, on the CDC, on the vaccine protocol, on public health in general. We want to just catch Walter's ideas. He's one of the leading public health thinkers in the country. Previously served as health commissioner in Pennsylvania, was chair of APHA, prominent player again with PNHP, and a strong supporter of one pair of states. And so, Walter, love to hear your comments, your thoughts on where we are right now, maybe things that we can do, and how do we get on the other side of this, really, this very difficult time period that we're in right now. Walter, thank you so much.
Wow. Chuck, can you hear me?
Yeah, yeah, you're good.
Oh, good. Uh, I hope most of you people are on the West Coast because I have to tell you, it's on East Coast, we're it's like close to our bedtime. Anyway, it's great to be here, and I wasn't totally sure all the things I could talk about. So let me say that I hope this becomes a dialogue where we have some give and take and thoughts about what's going on with the state of public health in this country. Uh, Let me start by saying that I have devoted most of my professional life to the field of public health. I used to be the health commissioner for the city of Philadelphia, as an example. I served as president of the American Public Health Association. I helped start a health department outside of Philadelphia called Montgomery County Health Department. And even to this day, all my activities that I spend my free time, even though I'm retired as a public health doctor, I spend my time really advocating for public health type issues. And so you can imagine my consternation about what's going on with our current government, because never have any of us fully witnessed the type of frontline attack on healthcare and on particularly the public health workforce. Most people don't know a whole lot about public health. Most of us who work in public health often kid that we had to try to explain to our parents what we really do for a living. And that's partly because, public health has always been one of those invisible things in our system. Public health is about what we as a society do to assure conditions so that people can be healthy. So if we assure, for example, that the air is breathable, that the water is clean and drinkable, the food is nutritious, those are things that are traditionally about public health. But if you think about it, uh, things that we do, like telling people to wear their seatbelts, not to smoke in your restaurants, and even how we finance healthcare, all those things are ways in which we assure conditions so that people can be healthy. So, in many ways, the foundation upon which you build a healthcare system is public health. We don't talk about that. We don't teach that in medical school or nursing school and so on. Increasingly, people are thinking about the idea that public health is an important thing. When I applied to medical school, we had to learn biology, chemistry, physics, all these sciences that were considered prerequisites to being a doctor. What I think was not taught until more recently uh, at the undergraduate level is public health. And for some reason, what I think is a more important prerequisite to any health profession, nursing, doctors, social work, whatever, is to have a fundamental understanding of public health because it is the foundation upon which you build a healthcare system. And if you don't have, uh, a robust public health infrastructure, then it's very hard to practice medicine. It's very hard to practice to be a nurse or, when you're a social worker, to be reliant on the fact that there are resources out there in the community that you can refer people to. So I point this out only to say that I think we have undervalued public health tremendously in our society. If you watch the news tonight, I can almost assure you that you will see something about the police, the fire, the car robberies. You will hear almost nothing about maybe what the public health department did. Uh, and I say part of this because it's somewhat the nature of people who work in public health that we like to be in the background. We're often like I often say we're like the missionaries of healthcare. People don't fully appreciate us until things fall apart, like when we had a pandemic like COVID, or like when the water is no longer drinkable, like they had in Jackson, Mississippi, or when we have tremendous wildfires like you have in California and much of the West Coast where people can't breathe anymore. I mean, it's killing people. Then you start saying, wow, this is a big public health problem. But until these things happen, people don't fully appreciate it. So imagine, if you will, that healthcare, public health is the foundation upon which you build a healthcare system. So who funds public health? Is it that people all think, oh, wow, you guys are wonderful. You get my water clean and so on. And so therefore, I'm going to contribute money to you. That doesn't happen. I mean, people in public health have to depend on taxpayer government funds. And government is the major funder for public health, as it should be, because public health is for everybody. And if we don't have a system where uh, we can all benefit from the good things that public health do, then then you start seeing things fall apart. Well, what happens when government, the major funder of public health, turns its back on public health itself and decides, we're not going to fund you anymore. We're not going to provide. We don't think it's important. It's maybe okay if, or maybe we have higher priorities than, funding vaccines or something prevention or making sure your water is clean or that you can breathe fresh air. Maybe we have higher priorities. Now, increasingly, of course, people are starting to realize that that's like insanity. If you don't have drinkable water or kids who are vaccinated against infectious, communicable airborne diseases, you're going to have a huge problem. It's not there yet. We haven't had the huge pandemic where 1 million people come down with measles. At which point, I think people would start waking up and saying, I think that was a big mistake that we did, not getting more people vaccinated. We're not there yet, but we increasingly are realizing that, you know, these type of things that we do in public health are valuable, are very important. And and so that's why I say this time is an unprecedented moment in our history in public health because we actually have a, a federal government which actually funds the Centers for Disease Control, which maybe most people don't fully realize, sends money to all 50 states to fund their state public health departments. And those monies from the state public health departments then go to all the local health departments that actually do all the hard work in your counties. And if you don't have that funding, basic funding from the federal government at the CDC to fund the state health department, then there is no money at the local level anymore for doing public health work. And the implications become much more uh, homegrown uh, and people will start realizing at a much more visceral and local level. So when you start telling the kids who show up at your vaccine clinics at your local health department, well, I'm sorry, we don't have vaccines for you anymore, or we changed the rules and now suddenly you don't qualify for vaccines because you don't have the right income, you haven't done the right work requirements, maybe, or we've changed the rules in which you can get your kids vaccinated or you vaccinated. That kind of stuff happens, and it's actually highly detrimental to to the health of this country. You would think that if 1.2 million people died of COVID, that America would have a wake-up call and and say this is really a disaster, which it was a disaster. It's still a disaster, and that maybe we should change how we do healthcare business, the business of healthcare differently. The most amazing thing about, a lot of people talk about COVID, but to me, the most amazing thing about COVID is that we have done nothing different. We can lose 1.2 million people in this country, and we still have the same corrupt, dysfunctional healthcare system. Instead of actually enhancing public health, we actually are cutting back resources for public health. And we're almost guaranteeing ourselves that we will not be prepared for the next airborne communicable disease or mosquito-borne disease that hits this country. And we're totally uh, uh, in the dark about it. So I say this all as a preface to some of the slides I want to show. Can I share my slides here? Can you give me sharing? Okay, so I'm a host now. So let's
Mike,
see if this works. Can you
Yeah,
see that,
yeah,
everyone?
you can, yeah, go ahead.
Uh,
see if we can raise the magnified a little bit.
We'll put it in presenter mode.
oh, yeah, I'm going to try to put it in presenter mode. Play from this. Can you see it better?
Better.
Yeah,
That's good.
Okay. Can you all hear me and see it?
Yep.
yeah,
So here we are, RFK Jr. in public health. So,
Boo.
I mean, one of the most outrageous things he did was, despite the fact that in his confirmation hearing, he said that he would honor uh, the vaccines science and that he would not disband the Advisory Committee of Immunization Practice, or ACIP, which makes all the recommendations nationwide for vaccines. No sooner than after a few months of falling in the job, he had the audacity to disobey the senators who confirmed him, and he fired all of the members of ACIP, and he picked known anti-vaxxers as their replacement. I mean, at that point, in my mind, any reasonable Senate would have gotten up and tried to impeach him for violating what he testified in his confirmation hearing and for endangering the potential lives, particularly of children in this country. But nobody did anything about it so far, at least. He's overseen what has to be the most egregious decimation of our premier health agencies, the NIH, which has, I mean, there are people with doctors and nurses and so on who work at the NIH who could have made probably twice as much money in industry, who have decided that they want to do public service at the NIH to do research, to help do clinical trials so that we can advance and find the next cure. Much of the uh, lauded mRNA vaccines were created through money that was funded through the NIH. Much of the reasons why HIV is no longer a death sentence is because NIH has done a tremendous amount of research to find new drugs to treat HIV, and it's turned it from a almost death sentence, most of our early lives that people remember HIV, to one that is now really a chronic illness. Uh, I could go on, but the point here is that the things that we have done with NIH has been instrumental. We have changed the nature of cancer in this country so that cancer actually can be, in some cases, actually cured. Hepatitis C, which was almost invariably leading to cirrhosis, is now a cured disease. That's, I mean, there are on and on examples of things that we have done that I think have dramatically improved the lives of Americans. And it's reflected in the increasing life expectancy of Americans. But now we have these widespread layoffs and we are purging the leadership and we were replacing the leadership with sycophants. The new acting director for the Centers for Disease Control, for example, is a guy named Jim O'Neill. What is his background? He is a Silicon Valley executive, venture capitalist who knows nothing about healthcare, no, not a doctor, not a researcher. He knows nothing about healthcare, but he's a friend of you know who, and therefore he's acting as the director of the CDC. I hope the Senate never confirms him, and I hope they embarrass him uh, enough that they find someone actually qualified to be in that position. You know, RFK rejects his own data, and he has purposely undermined the credibility of the CDC, the FDA, the NIH, HRSA, on and on about all these federal agencies in a way to basically undermine their credibility and to put in his own people. And it's gotten to the point now where states like the Western states, California, Oregon, Washington, for example, have banded together and said that we will write our own immunization recommendations. We're not going to necessarily follow what the recommendations of the CDC. And other states are doing the same thing. So he's basically using divide and conquer, if you will, a very common technique in healthcare to undermine the faith that we have in health agencies. Uh, I don't know if all of you saw, but there's an excerpt from the CDC
shopping
where he testified. I mean, NBC did a little vignette about his testimony in front of the CDC. If they did a commercial here.
This is finding.
Tonight,
Can you hear that?
Sir, you're a charlatan.
Health Secretary Robert F. Kennedy pressed by senators about his controversial shakeup at the CDC.
You're making things up to scare people, and it's a lie. With respect, I do not think I'm the one making you.
Kennedy questioned about changes to recommendations for the COVID vaccine to say it's only needed for older and high-risk Americans, which a CDC panel will review within weeks. This from Republican Bill Cassidy, a medical doctor whose vote was critical to Kennedy's confirmation.
I would say effectively we're denying people vaccine.
Democrat Elizabeth Warren arguing the new recommendations mean some people can no longer get COVID boosters at the pharmacy.
I'm not taking them away. Everybody can get access to them.
No, they can't walk into a pharmacy the way they could last month and get access.
It depends on the state. It depends on the states.
A year ago,
They can still get it.
But Rachel Sampers-Alaya says she's been unable to schedule a COVID booster, and she's worried about her daughter with asthma.
My biggest concern right now is going through the winter and ending up with COVID, and having a kid end up in the hospital.
Another flashpoint, the firing of CDC Director Susan Monares, who today writes she was dismissed because she refused to pre-approve the recommendations of a vaccine advisory panel newly filled with people who have publicly expressed anti-vaccine rhetoric.
I did not say that to her.
So she's lying today to the American people in the Wall Street Journal.
Yes, sir.
Kennedy, who's pushed debunked theories linking vaccines to autism, saying he's not against them.
Saying I'm anti-vaccine is like saying I'm anti-medicine. Well, I'm pro-medicine, but I understand some medicines harm people.
And saying revamping the CDC is necessary because it made critical mistakes during the pandemic.
When it's disastrous and nonsensical policies destroyed small businesses, violated civil liberties, and the people at CDC who oversaw that process, who put masks on our children, who closed our schools, are the people who will be leaving.
Today, he was pressed about how many people died from COVID.
You don't have any idea how many Americans died from COVID?
I don't think anybody knows that because the There was so much data chaos coming out of the CDC.
You were sitting as Secretary of Health and Human Services? How can you be that ignorant?
And tonight, a former CDC director says Kennedy is dangerously undermining the institution.
This is about not fundamentally being grounded in the evidence and the data that should drive decision making. And that is why we raised the alarm.
And with that, Ryan joins us now live from Capitol Hill. And Ryan, I know you have new reporting that after that heated hearing, the White House is giving Secretary Kennedy a vote of confidence.
Tom, that's right. Kennedy had moments where he was very critical of the COVID vaccine, but he did praise President Trump's Operation Warp Speed, which helped to develop it. Tonight, two administration sources telling NBC News the president still has confidence in him.
We think.
Well, I thought that was actually very interesting. Bill Cassidy, I don't know if you heard that part, but he ambushed RFK and he says, "Do you agree that Operation Warp Speed was a tremendous triumph of Trump, and maybe, in fact, the only thing that Trump will be considered as a tremendous success of his administration?" And RFK said, "Oh yes, it was a great thing. In fact, I think he should get the Nobel Prize for that or something." And then Cassidy pointed out, "Well, you do realize that that was developed using the mRNA technology, of which you just removed $500 million in research money to stop any more mRNA vaccine development." And of course, he really couldn't defend his own actions on that. I mean, that's how crazy this whole administration is. It's unprecedented in my mind when 9 of the former directors of the Centers for Disease Control actually write an op-ed in the New York Times saying that this man, who is the Secretary of HHS, is endangering every American's health. And that's because he's basically dismantling the CDC. And and just today, the person who was fired, Susan Monares, was actually asked to come back to the Senate and testify about RFK's decision to fire her, because, as you just heard in the testimony, RFK says that Susan Monares lied when she said the reason why I was fired is that I would not go along with anti-vaccine recommendations, and that I had to only rubber stamp whatever the ACIP, the newly reconstituted ACIP, came up with. So you can see that there's a lot of chaos that's happening at the CDC. Subsequently, all the deputies, major deputies at the CDC, walked out with Susan Monares. So basically, there is no more leadership at the Centers for Disease Control. This at a time when we still don't know about all the various diseases that are going to be impinging on America, including as far as I know, a measles outbreak that still happens to be out of control. And to help make sure that we don't know and to stay in the dark, the Trump administration has taken down thousands of web pages that basically were being used to inform Americans about what's going on, not just at the CDC or at health agencies, but in every phase of government. Think about climate change, that all the climate change documents have been going on. Anything that they don't want people to really criticize the government about, they've taken away all these websites in order to keep us in the dark and to make us, act like we're stupid or something. So that is, in many ways, a statement about having us lose faith in government to the point where we're kind of like on our own now, and we have to, figure out this, whether which schedule we follow or whose advice do we listen to, and so on. And this is the point that I wanted to make as it relates to single payer and national health insurance. And that is, you can't, in some respects, the Trump administration wins either way. If they show total incompetence in what they do, then people will point to government and simply say, look, your government is ridiculous. You don't work. What happens if we have national health insurance and they say we're not going to fund vaccines anymore, or something else that people think are very important for us to do. So if government doesn't work and they purposely try to undermine how government works, people will use that as an excuse to say you can't have government actually run or finance a healthcare system. Or you could actually say that, you know, if government actually succeeds, uh, at least in the Trump administration mind, then there are lots of people in America who will feel totally polarized and divided by the policies they come up with. I mean, abortion obviously becomes one of them. Uh, Gay rights and uh, care for gender identities and so on. All of these become highly controversial points to the point where people say, well, therefore, we can't ever have a national health insurance system. And if we can't have a national health insurance system, then everything should be privatized. And in fact, we haven't really heard too much from CMS yet, but don't kid ourselves that Dr. Oz, he has his eyes on privatizing all of Medicare and turning it all into a giant Medicare Advantage program, and to basically undermine all of what we're doing in healthcare. So I'll stop because it's probably better to hear what you guys have to think about this. But I have to say that in many ways, the worst thing that could have happened for our cause is to have the Trump administration currently in office. Okay.
Thank, thank you, Walter. That was really excellent, and I want to make sure that we get your portion of the program here going viral. We really need to push this out, this conversation, and in a term that I would encourage you to think about, and others as well, is that you alluded to it certainly, but that this is quite intentional. I mean, the whole MAHA, right, Make America Healthy Again, is an extension of MAGA, which really is it's a consummate fascist ideology. And fascism is about creating an economic system where corporations and billionaires control everything. And it's not just healthcare, it's really all things. It's the military, it's the media, it's agriculture, it's sports. I mean, you name it. But this is really what's coming at us and has been coming at us, and this is quite deliberate. Bobby Kennedy is a Trump sycophant, and he's not going to do anything to cross up Trump. I think he learned from the example of Tulsi Gabbard when she called him out on the Iran military strike on their nuclear arsenal. So can we really begin understanding and thinking of this, what's coming at public health, as an intentional campaign? It's rooted in, right, Project 2025, whose roots go back to the Powell memo was it 1971? Excuse me, Lewis Powell. But this latest iteration is designed to give billionaires greater and greater control, and as you said, the ability to privatize and maximize their profit and control over our society. And to hell with the people who are hurt or damaged and suffer under a broken healthcare system. What are your thoughts to that? And then we'll take questions from the field. Thank you, Walter, so much. Really brilliant. Really, really brilliant. Thank you.
No, brilliant. But well, I think, as you pointed out, this is a deliberate attempt to sabotage our government, and anyone who has maybe had some faith in government, whether maybe FEMA, who would come out and help us, or if there's some type of other outbreak in our communities, we would turn to government, to help us. And now, basically, Trump has taken the money, our tax money, and kept it for himself so that he can build more detention centers and go
Right.
after immigrants. And who and to hell with trying to help people out. I personally am offended paying taxes now to this federal government. I would actually much rather pay my same taxes to my state government because at least they're the ones who are feeling the heat about trying to rescue Medicaid and our schools and so on that are falling apart under this current administration. So, uh, and it's not surprising that there's this other alternative movement being proposed by private equity that says, well, we can take it over. We'll take over your hospitals. We'll take over your charter schools. We'll take over, even your garbage collection. Everything that the public sector used to do, we'll do it now and basically privatize everything and then have our own profits out of the system. So
Yeah.
it's a very pernicious and cynical way of how we are in our society. And the truth is that um, we're going backwards as a nation at a time when, if you look at what's going on in the rest of the world, who have high-speed bullet trains and incredible technology that they're developing, they're beating the crap out of us, you know? I shouldn't say the big S word.
All right, thanks, Walter. Let's see, do we have folks who have questions? Looks like Lynn, Mystic Healer. Lynn, yeah, just a direct question for Walter. Appreciate you, Lynn, and other folks. Yeah, get in the queue, throw up your hands. We'll take this for another 10 minutes or so. And then we'll make a real point of sharing what Walter's brilliant insights here. So, Lynn,
Okay.
thank you.
I just wanted to mention there's a doctor's book of food remedies, there's a doctor's book of home remedies. The Love is Medicine Project.org. And this, in comparison for me, studying alternative healing, being a registered nurse in 2 countries, I decided I have been studying alternative healing since 1975. And I just wanted, this is such a critical text for what we're talking about, because this is medical hypnosis and it's for pain management, addiction recovery, anxiety, phobias, dental dis. I can go on cancer, autoimmune, everything big pharma gives a drug for. Okay, everything.
Yeah, Lynn, if you could put a link into the chat, but do you have a direct question for Walter?
Yeah, and I was just wondering, are you aware of any alternative healing modalities and that are already, if you can, and do you know about Dr. Emoto's work?
I don't know Dr. Emoto's work now.
Okay, that's right there. Dr. Emoto's work, he's a scientist. Look up his book. It's about the water. He's the one from Japan that knows that the water is affected by stress or dark thoughts. It affects the water in our bodies. So if we don't get that we're all connected and we need to de-stress people, that is critical for healing. I mean, it's totally critical. And the doctor's book of food remedies, the doctor's book of home remedies, there's 3,000 ancient plant medicines, which ties into the understanding. Real quick, please, Chuck, it's so critical. The drug warfare programs they started over poppies, they started over cannabis and cocoa leaves. It's insane what they've done for human trafficking, gun sales, private prisons, ICE. I mean,
Great. Thank you, Lynn. Appreciate it. Just drop any number of links into the chat and you can have even a direct conversation with Walter. I don't know, Walter, if you want to just even put your email into the chat for people to follow up with you. Yeah, do other folks have questions or comments? So this unprecedented, unparalleled attack on American public health. What is it going to take to turn it around, Walter? I know that's a big question, but what do we do, or what can we do? I mean, one of the things you and I talk about is sort of visualizing the world post-Trump. right? Is it what is it that we need to accomplish, and how do we need to think about what it is that we need to do in this moment in order to get to a restoration, not only of public health, but obviously get us to a universal, guaranteed, single payer system for all Americans. What are your thoughts on what it is that we can and need to be doing in this moment, Walter?
Well, a lot of people think that uh, for the Democrats, the one silver lining that actually people favor Democrats is health care. And uh, it may not necessarily be single payer that becomes our message, but it could be public health is our message. As an example, you could have a billboard that says something like, Democrats, we're the party that believes in vaccines, something like that. Or uh, we're the ones who believe in funding cancer research. And these type of uh, sound bites, if you will, um, the Republicans have been very effective in coming up with their own sound bites. And I think taking public health and thinking about messaging with them could actually play into the hands of the Democrats. And if you actually embrace the idea of public health as a winning message, which I saw in some polling data in Florida when they announced that they're going to no longer have vaccine mandates, the majority of Floridians, who also, by the way, voted for DeSantis as their governor, the majority of them disagree with their own Florida Surgeon General, who has and disagree with his decision about vaccines. So I think people we could have some unanimity around the advantages of vaccines and use it to the advantage of politically. And it would be an interesting idea that I think what we have often taken for granted because we've never really experienced the defunding of NIH or the defunding of CDC could be to the advantage of the Democrats if they use it wisely. But they're probably going to blow it up and not do that. Do something stupid.
They're not, yeah, right. Let's face it, the Democratic leadership is not particularly listening well. They are tone deaf, and they don't even abide by the Democratic outcome of the New York City primary election, and the nomination of Mamdani. This is appalling. We all know this. But the Democrats are not going to come right into the rescue. We need to look in the mirror, right? We need to see that we're the ones who've got to build this movement and connect with other social justice campaigns. But you're right, 100%. It's astonishing that the biggest advantage the Democratic Party has is in surveys is they're far more believable on healthcare than other Republicans, and yet the Democrats seem determined to squander that. Let's see, Catherine, your hand is up. Catherine?
Yeah, I know we're not supposed to necessarily be partisan or whatever, but the frustration that I have seen with the Democratic Party, and while I continue to call myself an independent, is that they're constantly, I feel, crying wolf. The little boy who cried wolf. And I think people are at the point of like, no, we don't believe you.
Right.
And so when are they really gonna hold themselves accountable to do the things that they say they're gonna do to get elected, and then they get elected and they don't?
So in the short term, what should we do you think, Catherine? I mean, what should we activists, single payer proponents be doing?
I think we need to be doing exactly what's happening in New York with Mondami and all this stuff, doing like and those types of voters coming out in droves in numbers too large to rig,
Right.
know.
Yeah,
That's
vote
the
with our feet.
and
Massive demonstration. Yeah, massive demonstration in DC this past weekend. I really appreciate that, Catherine, very much. Walter, a response to Catherine?
Well, I think you're right. I think Barry is the one who said in the last section that the Democrats get elected and then they become cowards. They don't actually follow through. And I think That's why so many of us have lost faith in the Democratic Party. I only wish that we had, other
Exactly.
stronger third parties that we could actually embrace.
Yep.
So I don't have, I don't wish I knew how to solve all this, but I do hope that we start electing really people who are going to hold true to what they say in their campaigns, and who manage to get progressive votes and then actually stick to it.
Super. Let's see, Mike, your hand is up, and then we'll put a wrap on things. Mike, you want to unmute?
Yeah.
Yep.
So I'm getting involved with Indivisible. It's a 501c4 organization. And yes, they've been good at events so far and just building their structure as a power source. And one thing we're going to be doing here and across the nation is developing house parties or living room conversations and doing it very carefully, mainly to build relationships. And then among those people that come over, and we can say, how are we going to take care of our neighborhood if we have an emergency? Is anybody here worried about, getting their Social Security? How about your health care? And sort of develop conversations and then follow through with those that want to continue talking about what's happening with healthcare and Social Security, not invite them and say, I'm going to lecture you about single payer. Start
Great.
with an organization just to build relationships and then develop that.
Yeah,
So
listening intentionally. Great, Mike. Thank you. Walter, a closing comment for this evening. Thank you again, everybody, for your contributions. Walter and you and Riley, who was in the first half, thank you so much. Walter?
Yeah, well, thank you so much for inviting me. You threw the topic at me, and I had to do some thinking about what I wanted to say. So it actually helped clarify some things for myself
Beautiful.
about, the dangers that we're in right now with a dysfunctional government that is dismantling our public health agencies. And I hope all of us take advantage of the fact that this dismantling hopefully will backfire against the administration, and the American people will fight back and say, we believe in public health and will fight for it, and that it will lead to the downfall of this very corrupt administration.